Hello, my name's Joel Dunning, and I'm delighted to be joined by Dr. Nikki Stamp. We're here at ANSCAT 2019 in Australia, and I'm delighted you can join me. Now, Nikki is a cardiothoracic surgeon, but you have a very interesting alternative almost career. You've been a presenter on TV.
Yep.
You have, I think, 18,000 Twitter followers and many Instagram followers. And really, what I wanted to talk to you is about how we can actually be positive and proactive and use social media for good. But I suppose maybe just start by just telling us about yourself, where you work, and how you got into all this.
Okay, so I'm from Perth, WA, which is the west coast. So it's actually quite a way away from where we are now, and it's quite a bit warmer as well. I did my training throughout Australia, adult cardiac, bit of thoracics and transplant surgeon. And I really fell into this second career as a bit of an accident. It started out with writing a blog for, I really can't even remember why I started doing it, but I did. And it escalated to writing for Huffington Post, and then that escalated into working for ABC, which is our public broadcaster, which escalated into books, and it just keeps ticking along strangely. It's really strange.
And you did live TV, didn't you, doing operative to the nation? How did that go?
So I hosted Operation Live, which was it was shot as live, so even though it was advertised as live, we did it as live, cesarean section, so it went really well. Healthy mum, healthy baby, but it was really well received. People, I think, really enjoyed that look into what happens in what is a very normal world for us. It's not a normal world for our patients, so I think it was a really nice look behind the scenes for them, and it went really well.
And you address a whole host of issues sort of on Twitter and Instagram, and I guess a lot of people watching this, we're all sceptical old fogies about these things, but what do you see are the real benefits of actually having a voice out to basically our patients?
Yeah, I think that's exactly right. Our patients are there, and I'm not advocating interacting with them directly and providing personal advice. That's obviously completely inappropriate. But I think it's good to be sceptical about social media, because it is a bit of a double-edged sword. You can certainly make some mistakes yourself. Sharing patient information, maybe sharing things that aren't really wouldn't really pass the society's litmus test, of what's appropriate behaviour for doctors. You can certainly get into very stressful battles with other people online, and that's obviously not a great thing to do. But I think really, for me, the benefits have certainly outweighed all of that. I think, the ability to interact with your colleagues, I've formed some fantastic relationships, personal, academic, with colleagues from all around the world. And all of a sudden I have these world experts in my pocket. I can say, listen, I've got this really difficult case, what would you do? We've had academic collaboration, so with some fabulous surgeons like Mara Antonov from Houston. We've been able to put out some good publications and papers, research projects, mentoring, and keeping up with journals, I think, is or any knowledge for that matter. The two thoracic journals have the TSSMN, the Thoracic Surgery Social Media Network. It's a bit of a mouthful, but we run tweet chats, which are basically like journal clubs. So you get all of that educational value, and it's very portable, it's very rapid, it's up to date. I think really for me, if you're sticking to that kind of beneficial side of things, that it's totally worth the perceived risk.
So if you're talking to someone who's brand new to all this, would your first recommendation be, go for TSSM?
Yep.
Sort of go and log on to them via Twitter and see how it goes from there.
Absolutely. I think the only way to sort of find out if it is something that's going to be worthwhile for you is to really get in and do it. I think Twitter's a great start. I think compared to some of the other platforms, there's a lot more academic discussion and circles that you can join there. And TSSMN, which is a mouthful for me, I'm sorry, is a great place to start, because they do retweet out useful things like discussions, journal articles, conference-related, tweets or discussions. So it's a really good place to start, and then you kind of learn who you can follow. But I follow all the big journals. I don't know about you. I follow like New England, our two main journals. I follow Circulation, and all of a sudden you've just got all this information that you would otherwise have to go out and ferret through just comes to you, and it's such a fantastic way to keep up with it. I think I read more journals, I read more broadly now with social media than I ever did before.
And I guess some people would be slightly worried about their patients, seeing them on social media and things. Have you found that it's helped with interactions with patients, or have you stuck to professionals? Or?
Yeah, look, I think I still get the odd patient who goes, I follow you on something, and I'm like, it's so weird. But it's not, I don't interact specifically with my patients. I don't give out personalised medical advice. I tend to talk a bit about sort of more public health type issues, like diet, exercise, trying to cut through some of the really bad medical information that is available online. I think that's a really good reason for us as clinicians to be online, because there is so much noise. It's really important that we start putting out some good quality information.
Yeah, you put out things about vaping.
Vaping, yes.
There's a lot of health things, and you sort of exercising and health. And, you've got a lot of good things on that, and I mean that's a brilliant public health thing that we can do really as a service.
Yeah, and I look at it, in this way. So in a normal day, I'll do maybe 2 or 3 parts. If I've really got my skates on, and so it's 2 or 3 people that I might be able to help in the course of a day. But say for the first show I made with, and this is obviously TV, but just to give you an idea of reach, the first show I made with ABC Catalyst, we had over 500,000 viewers, and just a small proportion of those viewers saw that and made some change. They gave up smoking and they started exercising, or they just saw their doctor. That would be a really big win in my book, and I think we all have the power to do that by being online.
Yeah, absolutely. And so I haven't met many authors, and you've written 2 books. How did that come about? That's fantastic.
Yeah, it's kind of.
How did you fit that in your life?
I don't know. I think a classic heart surgeon just like being busy. No,
You're passionate about sort of health and
absolutely.
Image.
Yeah, I think,
and that's what it's about.
Yeah, absolutely. So I've got two books. Can You Die of a Broken Heart, which is obviously very much my area, and that was really fantastic. It was a really good learning experience. I think that we're all better communicators than we realise. That's what we do every day. We explain difficult concepts to our patients in terms that they can understand, and that's really all that was for me. And my second book, which has just been released in Australia and is coming out in the rest of the world in January, is Pretty Unhealthy, which sort of looks to sort of unhook some of these concepts we have around what we perceive health to be, trying to sort of steer away from fad diets and things like that, and trying to just get into what is actually good for us. And actually, very strangely, has spawned my PhD, which is looking at how we can encourage behaviour change in patients who have undergone cardiac surgery. So it's a bit of a very strange, convoluted career path I'm taking, but it's been really interesting. I've met some amazing people, and I think improved my skill set for sure, and I think that all feeds back into my day job.
And I guess the final passion you have is obviously promotion of women in surgery.
Yep.
And did I read somewhere you weren't sure whether you'd recommend heart surgery to an 18-year-old, but would you or wouldn't you?
I would. I think some days, I think we all have those days where you think, oh goodness. But I definitely would, because I think that there is no reason why, if you have the ability, and I think you need to have a love of this job because it is consuming, it can be challenging, that if you want to do it, you absolutely should. Yeah.
Is there one thing that the system needs to change then that would make a difference? What are you going to tell to us, male pigs?
I think it is the system. I think we all have individual roles to play, but I think by and large our workplaces have been set up, in a time when things were different, and the world has changed, and a lot of the ways that we've been taught to work, or we continue to work, aren't really conducive for attracting the best and brightest. And the best and brightest come from a broad section of society. So I think changing the system is the way to go.
Great. Well, it's It's been a pleasure talking to you. Very exciting.
My pleasure, thank you.
Hope to see you again a lot more, and maybe
Yes.
we'll get you doing some interviews on
Absolutely.
CTSNet. That'd be
Can't
great.
wait to talk to some people.
Yeah. Watch out for you. Yeah, great. All right. Thank you very
Thank you,
much.
Joel.
Yeah.